go down here and do this with it. There we go. Hi, everyone. As mentioned, I'm Erin Maughan, Director of Research at the National Association of School Nurses, and I'm thrilled to be here, and thank you for the opportunity, AFT and others, for the invitation. I was asked to speak about the role of school nursing and specifically return on investment. So I'm going to just mostly talk about that. I did want to let you know, because of our time, we wouldn't have time for this, but in your packet there is a handout that speaks a little bit more to the role of the school nurse specifically, since there's not really time to go over that, but suggest if you have time to read that. And it also talks about, because as Terry mentioned, there are schools that have school-based health centers and then school nurses, and they are distinct. And both have very important roles, as was mentioned, in addressing student health. And the handout talks a little bit more about that. The role of the nurse in all of this is the public health and that population-based care, as well as some of the primary care in regards to students that have chronic conditions and working with them to be able to self-manage their conditions and could keep them in school. That's the goal of both, I think, is to keep the students in school and ready to learn and be healthy. And there have been studies that show that school nurses do have a positive impact on attendance, keeping them in school, and then also early dismissal, so they don't get dismissed because there's a nurse that can identify and determine, do they really need to go home, or can they go back to class and take care of the situation, as well as keeping them on seat time. And I could talk a lot more about the other impacts of school nursing, but again, today I was asked to focus specifically on the return of investment, so that's what I'm going to do. I'm going to speak about two studies in particular. The first one was done, and the reference is at the bottom. And this study was looking actually more at how much time and the impact that was taken of other people in the schools if a school nurse was not there. It was a cross-sectional design. So what they looked at was if there was a school nurse there, and then when there wasn't, who was needing to address those situations that the children still had health concerns, needed medication or other conditions. And they found that when there was not a school nurse in the school, then principal would spend approximately an hour extra each day doing school-related things. Assistant principals as well. Clerical staff, usually like the school secretaries, they oftentimes would help. They spent about 46 minutes each day doing health care. And then teachers also were found spending about 20 minutes per day in this study. Different studies have different times. So they took this information and they took the average salaries of these different employees, and they figured out that the cost saved per school was, as you can see, $133,174.89 from having that school nurse. And with the analysis taking the salary and fringe benefits of a school nurse, found that for every dollar put into school nursing, the school districts actually saved $1.84. Because it was able to keep principals and teachers and others focusing on the education and not the health practices. So that's there hasn't been a lot, though, regarding the cost analysis, but there has been a pretty significant study, and that's the other one that I wanted to talk to you about today. Here's the reference. I only bolded the title and the reference, basically, but here are the authors, of which I am one. I helped more with the discussion and analysis and putting it into context of school nursing. The lead author is Leon Wang, who works for the Centers of Disease Control. And the other authors here are school nurses from the state of Massachusetts, which is where they got the data from. They do great data collection in Massachusetts. So what happened, what it was they were able to take, as I mentioned, Massachusetts has an annual report. They actually collect data monthly, and they put it into this annual report. And for this study, they used the 2009-2010 Essentials School Health Services Report. That's the report that they had. Here are a few of the statistics that were used and the data that was used for the analysis that was completed. So you can see how many, in 78 districts, 933 schools. I won't read them all, but you can kind of get a feel. And in Massachusetts, there is usually at least one nurse in every school. In some of the larger schools, there's actually more than one nurse. So that is significant to this study, because not all areas. I was a school nurse in Utah, and when I began, I started with 25 schools that I covered. When the time I finished, they had hired additional nurses, and I was down to 11, which I thought was pretty good. So it's a whole different realm, and there's many reasons for that. But it's important in understanding that for the study. So what they did was here's the study design. They actually identified the cost using, and I'm not going to go into a lot of the details. A copy of the article is actually, I believe, in the packets. and if not, you could talk to me, but it explains a lot more detail. So basically, using very standardized costs, they were able to identify the cost of healthcare procedures, medical procedures that the school nurses were doing in the school, what that would have cost, for example, in a community clinic or healthcare provider office. And then they also looked, because the scenario they looked at was if there was not a school nurse, they made the assumption, well, then the parent would be having to come and do this. And so they looked at how much time it would have taken, the productivity loss from the parent having to leave work, and so lost wages if the parent had to come. And that's important. In Massachusetts, their law does not allow medication and things to be given unless there is an RN on site. In Utah, it's a different law, so it would work differently. But using that scenario, they identified what the cost was of parent productivity loss, as well as teacher cost productivity loss, of when they would be having to spend the time doing these things if there was not a school nurse. What was not included was anything about hospitalizations, 911 calls, or emergency room visits, things like that, and some other things. It was very specifically on medical costs that they were looking at in this scenario. When they did the analysis, as you can see here, the program cost, which included those medical procedures, medical equipment, supplies, and the nurse's salary, that kind, came out to $79 million. Then they looked at cost averted, which was the medical care, the parent productivity, and the teacher productivity, which came to actually, it was a total of 179 something. I didn't put that on the slide, I'm sorry. But when the net benefit came out to $98.2 million were saved by having school nurses there providing this direct care for the students, which when done as a benefit cost ratio comes out to 2.2, which would translate for every dollar that went into school nursing services, $2.20 was saved. And they saw this more, the other study I mentioned was more specifically saved for the schools because it just looked at time that principals and teachers and others didn't have to be doing the work. This one was more of a societal benefit because they included the parents and the time that would have been lost from the parents having to leave work as well and coming and the productivity there. So that was what the study showed. Other things that were not included that, even though it's great that that money was saved, I did want to bring up the point that there are some other things that they're looking at and they'd like to continue looking at it because nothing about health promotion. And a lot of school nurses do a lot of health education and health promotion, both as groups as well as to individual students who have specifically usually a chronic condition or are at risk for a chronic condition or concern. As mentioned, they didn't look at hospitalizations or 911 calls. They didn't look at attendance and dropouts, which, as Terry mentioned, is really important in public health and for education. And there was a few other things. So that's the next step. But to me, that only shows that if those were all factored in, the ratio would be much higher and it would be even more of a cost benefit. But we didn't have the numbers to do that. And I think that's one of the important take-homes and will kind of leads into what Martha will speak on, is the importance of the documentation of school nurses. And that's Massachusetts collects their data very well, which is why they were able to do this study in Massachusetts. Although because of this experience, Leon and others at our national conference in June will be having it's a poster presentation, but it's actually figured out and put the formulas in an Excel document. So other school nurses that collect this information will be able to do their own analysis to see how much they saved there. So preliminary, something, and she does it in a very nice step-by-step manner. So I just wanted to end, as I know this is about a return on investment, but of course it's really a return on investment of our children, not just the dollars. And so I love quotes. So it's easier to build strong children than to repair broken men. And I think that's, as school health services, that's one way that we can do it, by ensuring that students are in the schools and ready to learn. As I pass this over to Martha, I have one more thing to say, but I'll move the cord. And with the documentation, that is important that the National Association of School Nurses, in conjunction with the National Association of State School Nurse Consultants, are working on a joint venture so that school nurses collect data the same way across the country. So then not only would they be able to do analysis like this for their individual schools and their individual societies, but we could look at it from a more national perspective. That's down the road. But with that data, it'll be we'll be able to see the other outcomes and benefits having school nurses in the schools will have. Thank you.